Well, good morning, and I'm just delighted to be here and to witness how hardy my East Side residents are in weather like this. Coming from the West Side, we're wimps over there. But thank you so much for this opportunity. And March the 23rd, 2010, the President signed into law this incredible health reform legislation. Is it perfect? No. Is it really health reform? A lot of people still are arguing about that. But I can tell you from a public health perspective, it is one of the first elements of what I see as an opportunity to keep improving over many years, and it's definitely a step in the right direction. What does this all mean for Washington State? Well, of the 32 million people who didn't have any insurance, 800,000 of those 32 million people live in Washington State. And they are true beneficiaries as this implementation of this reform bill rolls out. There are a lot of very good things in the bill that are not talked about frequently, and from a public health perspective, which is the lens that I want to put on it, there is a lot of opportunity to benefit and change our focus from disease orientation to health orientation, health and wellness. And I'm just thrilled that the employer and business community is interested in this enough, because you will play a very important role. There are features of the bill that have already been implemented, and it's so complicated that every year you're going to see some element of it implemented, because it's not one of those things where all of the actions that were intended happen immediately. But there are some immediate benefits that have already taken place, including the fact that those of you who may have young adults in your households, they can be now covered on the parents' health insurance. I have one of those in my family, and believe me, it's making a tremendous difference. We will not have co-pays on any of the U.S. Preventive Health Services Task Force recommendations for preventive care, including screenings. Seniors are going to have an opportunity to have health maintenance and wellness evaluations yearly. We're closing that donut hole in terms of pharmacy benefits. And then there is much opportunity for improving the infrastructure of public health. And population health is one of those areas where, as employers, you too must become very well aware of investments and decisions you're making at the employer level, but based on population data to show that we are improving people's health over time. The state has a tremendous interest in all of this, because our budget, the budget crisis that we're in right now, we're facing that because of expenditures we can no longer afford in terms of care, health care. And a lot of the budget that the state is expending is spent on issues and diseases that can be prevented. And just to give you a taste of how this state is going on the health side, cardiovascular disease, diabetes, hypertension, in the United States, over a quarter of all the population have one or more chronic conditions. And if we're not treating chronic conditions and preventing them, then we are not doing what we need to do. And that's changing the culture, focusing on preventing some of the things we're treating. And when it boils down to it, there are three elements that we have to change in the health of our population, and that's sugar, salt, and fat. We've got to get the sugar, salt, and fat out of our diets, and we have to do it over time. Employers have a very big role in trying to promote this and trying to educate the employees. But we have a community opportunity as we roll this out as a community to improve the health of our residents. So I'm going to stop there because, and hopefully we'll have some more time, because my time is up.